We're really passionate about this project and we want to see it sustained. So we've made applications to a number of organizations, including the Home Office, DFID, the MRC, the AHRC, among other organizations, so that we could train the Survivors Network to deploy Mob App, which is being used to collect testimony in all 47 counties in Kenya, and so that we can enable them to have a skill that would be very useful to them in terms of their future employability in their personal lives, but also bring survivors to the table with policymakers so that they could change some of the stereotypes and stigma surrounding people who experience rape in Kenya. We applied to the ESRC IAA NGO Fund so that we could work with our partner, the Wangu Kanja Foundation in Kenya. The Wangu Kanja Foundation walks with survivors from the point of when they're trying to access medical services all the way through to trial, if the case goes to trial. We worked with them to analyze their existing data to be able to identify points where considerable case attrition is occurring. What we wanted to be able to do was to analyze the base of evidence that's required to demonstrate that there are problems of attrition in Kenya. And through this analysis, to be able to come up with solutions to better enable survivors to tell their story and overcome barriers to accessing health services and finding legal redress. So with the funding, we were then able to develop several research projects for which we're currently seeking funding to be able to take this agenda forward. So the impacts that we're having in Kenya, they're coming through the research that we've co-developed with the Survivors Network in Kenya and our other partners in the region. We're having workshops, for example, so that we can learn from one another. We could share the results of the analyses that we're conducting. We could also learn about how we might engage with policymakers to try to change the services and the mechanisms that are in place to help people access those services. One outcome of our funding is the development of this mobile app that the Rape Survivors in Kenya network will be using to interview other survivors. We're going to gather data from this initial pilot to be able to discover where some service gaps may lie, to also revise the app. And we're working with stakeholders such as the Ministry of Interior, the police, and the judiciary, as well as the Ministry of Health, to try to see if we could embed this app along the case referral pathway in Kenya. By doing this, it'll enable people to track cases throughout the system so that we could find what happens to cases once they're reported, where are the roadblocks in having these cases adjudicated, and at the end, to know how many cases are